Today's topic is a tough one. Unfortunately, I think all of us have been touched in some form by the opioid epidemic. It could be a family member, it could be a friend, it could be a friend of a friend, but I think it would be safe to say that all of us have been touched by this epidemic. No one is immune from it, as unfortunately I think we've learned. So we also believe that no one organization or entity can fight this alone. The state can't just do it alone, the county can't do it alone. It really requires a community-based and partner-driven effort. And that is why we're here today. Highmark Delaware is pleased to announce that we are partnering with 4 prominent community organizations on initiatives and programs designed to help address the opioid epidemic here in Delaware. We're providing financial support in the form of grants from our Blueprints for the Community Grant Fund, collectively totaling $325,000. Thank you. The organizations that we'll talk about, our partners, are really doing the hard part. They're the ones that are executing on the grants and implementing the programs. Highmark Delaware and our predecessor, Blue Cross Blue Shield of Delaware, have been here. We were formed in 1935, so over 80 years here in Delaware. We were actually started above a drugstore on Market Street in downtown Wilmington. But today we have more than 600 employees and serve over 450,000 members, most of whom reside in Delaware. So obviously, given our 80-plus year history, our presence here in Delaware and Wilmington, we are committed to serving the needs of Delawareans, not just for health insurance, but more broadly from a community standpoint. We're proud to be the only health insurer here in Delaware that actually serves all segments. So we have programs in place for those that buy insurance commercial, as well as Medicaid. We partner with the state on the Medicaid program. We also partner on the Affordable Care Act program. So we are covering the state both geographically as well as across each of our products. So our history, we have a long history here and obviously are committed strongly to the community. Since 2012, we have, Highmark Delaware has committed more than $18 million in support of over 200 health-related initiatives, organizations, and programs in our state. The $325,000 in grants we're announcing today come through the Blueprints for the Community Fund. It is a donor-advised fund that we've partnered with the Delaware Community Foundation, C. Stewart, on to administer. And we have, since the fund was established in 2007, we've awarded more than $12 million from this fund to nonprofit organizations in Delaware. Those have impacted, we've estimated, about 90,000 Delawareans, or close to 10% of the state. So today, pleased to bolster our efforts in the community, really focused around the opioid epidemic. First grant is a $50,000 grant to attack addiction to fill an emergency need for naloxone for our first responders. Secondly, a $100,000 grant to the Boys and Girls Club of Delaware as they continue their strategic prevention framework, Partnerships for Success community programs around the state. A $75,000 grant to Gaudenzia, Inc. to support expansion of its programs in Newcastle County, including a new facility in Claymont, Delaware, and outpatient services at the Claymont Community Center. And then a $100,000 grant to the Sussex County Health Coalition to support work with 27 community-based partners to develop community-based comprehensive plans to address the opioid epidemic in Seaford, Delaware. You'll hear from the leaders of each of these organizations momentarily, but first I'd like to introduce Dr. Carol Rattay to discuss the state's initiatives around fighting the opioid epidemic. Dr. Rattay has served as the director of the Division of Public Health since May of 2009. She directs over 700 employees who are focused on improving the health of Delawareans in many different fashions. Dr. Rattay and her team have been relentless in their focus around improving the health of Delawareans, including addressing the opioid epidemic. So I want to thank her personally for all the work that her and her team have done over the years and are continuing to do. So welcome, Dr. Rattay.
Thank you so much, Tim, and thank you so much to Highmark for your commitment to Delaware, and through these grants, the selection of these grants, I know is going to help us make a difference in Delaware, so I just cannot use enough words to express our gratitude to Highmark. This crisis is completely devastating to our state, to our nation. This past year, 2016, I should say, we had a total of 264 lives lost in Delaware to this crisis. And when we really began looking at our numbers in 2009, that was the first time we first saw more deaths from drug overdoses than motor vehicle accidents, and we have almost tripled the number of overdose deaths since that time. This truly devastating crisis is very complex, and there is no one entity that can resolve this alone. So as Governor Carney, Lieutenant Governor Bethany Hall Long, and Secretary Walker would be the first to confirm that government alone cannot reduce the impact of this crisis, this public health crisis of our generation. We must all be working together to address this crisis. And that being said, a lot of things have been going on, so I'm really happy to see our Lieutenant Governor here, who is leading the Behavioral Health Consortium for Delaware, which is a large public-private entity to begin to move us forward on behavioral health issues. The Addiction Action Committee, which many in this room have been involved with since the beginning, as formerly Prescription Drug Action Committee, the Addiction Action Committee was signed into law this past summer, and we hit the ground running with a lot of new activities to help move us forward. I was struck by something that Secretary Walker said last week during our Joint Finance Committee hearings. She said that each life lost leaves a ripple effect through a workplace, a neighborhood, and especially within those individual families. My hope is that these community blueprint grants will have a similar ripple effect, but this time as a force for good across our state. I'm so impressed by the breadth of these grants covering so many areas of need: prevention, treatment, harm reduction, and a community action plan. And similarly, we have taken a wide lens view in the Department of Health and Social Services and across state government. We, as state government agencies, have been working very hard to align our efforts to be strategic and to maximize the use of any resources that we have to our disposal. Some of the things that recently took place, Governor Carney expanded access to naloxone by signing a bill that makes the life-saving medication available at pharmacies without a prescription. Our Medicaid program has removed prior authorization for addiction treatment, including medication-assisted treatment. We relaunched the helpusherede.com website last year with more information, more resources in a mobile-friendly format and in multiple languages. And within our Division of Substance Abuse and Mental Health, we're creating a new vision for substance use disorder treatment, in which any person who is ready will receive not only the care they need when they need it, but also the wraparound services and peer support so that they can remain engaged long-term in their own recovery. We envision a treatment system that is engaging, comprehensive, coordinated, integrated, high quality, and person-centered. It will identify and reach people quickly and match them to the treatment services that best fit their needs. We know this crisis is complex and that our response must be multifaceted. With community partners like Highmark and those in this room and beyond, we stand ready to expand our services and supports to reduce the horrific toll that addiction is taking on too many families across our state. It is clear that these community grants are another important step forward. Thank you so much.
Thank you, Dr. Rattay. And Dr. Rattay pointed out how this work is closely aligned with the Behavioral Health Consortium chaired by the Lieutenant Governor. So, once again, thank you for the work you're doing on that area. Dr. Rattay also mentioned the need for naloxone, and I would like to introduce someone who knows that need all too well. He and his team of first responders see this every day in the field. Chief Lawrence Tan is the commanding officer of the Emergency Medical Services Division in the Department of Public Safety for Newcastle County. The EMS division provides advanced life support paramedic services to the incorporated and unincorporated areas of Newcastle County. I'd like to welcome and thank Chief Tan and all the first responders for their phenomenal service and support that they do for our community. So thank you.
The opioid epidemic continues to significantly impact the emergency response community in Delaware. As early as 2016, the State Office of Emergency Medical Services attributed a 26% statewide increase in emergency medical services activity to overdoses. Opioid overdoses are life-threatening situations. Opioids and narcotics depress the central nervous system, specifically the area of the brain that controls one of our basic life functions, breathing. An overdose patient will become unresponsive, and as the opioid continues to take effect, will stop breathing. The patient has minutes to live or die. As the body becomes starved for oxygen, the lips will begin to turn blue, a color that quickly spreads to the rest of the face. The patient's face will become deep blue or purple in color, as the brain and vital organs are deprived of oxygen. Left untreated, the patient will go into cardiac arrest, meaning the heart will stop beating. Every day in Delaware, emergency medical services personnel are dispatched to incidents classified as overdose, unconscious subject, respiratory or cardiac arrest, or ineffective breathing, cases that are related to the opioid overdose epidemic. Naloxone, or Narcan, is a drug that's routinely used to counter the effects of opioid and narcotic overdoses. Narcan essentially blocks the effects of opioids, which reverses the depression of the brain, and that leads to the lack of breathing and loss of consciousness. Administration of Narcan is directed at restoring a patient's breathing in order to keep them alive. The drug may be administered intravenously by paramedics or in the nose via a misting device. Patients receiving Narcan start breathing and eventually become more responsive. In 2017, Newcastle County realized a 19% increase in the number of Narcan administrations by paramedics, basic life support ambulance personnel, and law enforcement officers over the previous calendar year. The emergency medical services are on the front line of this epidemic. The problem continues to tax the EMS system in Delaware, prompting the dissemination of Narcan to basic life support ambulance personnel, law enforcement officers, school nurses, and even family members of patients struggling with substance use disorders. The widespread distribution of naloxone is for one purpose: to enable patients to survive an overdose event in order to move forward with recovery. You see, our patients have to survive an overdose event in order to engage in recovery from opioid addiction. We'd like to thank Highmark Delaware for identifying need in our communities and using their Blueprints for the Community grant to address that need. The opioid overdose epidemic is an all-hands situation, and partnerships and support, such as that being provided by Highmark Delaware, provide vital resources that are needed to address what we've heard here today described as the foremost public health crisis of the 21st century. Thank you, Highmark, for your contributions to the community and for engaging in a problem. We appreciate it.
Thank you, Chief Tan, and thank you again for all the work that you and your EMS colleagues do for our community. Next, I would like to introduce someone who unfortunately personally knows about, has been touched by the opioid epidemic. David Humes is a board member with Attack Addiction, and we've partnered with Attack Addiction and the county EMS department relative to the naloxone grant. A public policy coordinator as well as a naloxone trainer who tragically lost his son Greg to a heroin overdose in 2012. David?
When I hear a good quote, I'm not above stealing it. A vision without funding is a hallucination. Senator Ed Markey of Massachusetts. On behalf of our founders, Jeannie and Don Keister, who are here this morning, board member Liz Perkins up from Puerto Rico, we wish to thank Highmark for their generous donation of funds for naloxone. We're extremely grateful. Since passing the Community Access to Naloxone Law and Access for Departments of Peace Officers in 2014, it has been the vision of Attack Addiction to assure greater access for all departments of peace officers and the community. With the donation of these funds, this vision becomes a reality, not a hallucination. Far too many of our grassroots organization members have lost loved ones to substance use disorder. Members have been told by law enforcement that if we had a 911 Good Samaritan law or a Narcan law, our children may have well survived the overdose. Other members have loved ones whose lives have been saved by naloxone. Opiate heroin overdose is the public health crisis of the 21st century. Dr. Terry Horton has stated that while we have lost 308 Delawareans in 2016, 4 times as many lives were saved due to greater access to naloxone. In providing this donation for naloxone, Highmark is stepping up and placing the urgency that is required towards stemming this crisis. Last Monday, I received a phone call from Chief Patrick Ogden of the University of Delaware Police. The U of D Police Department had received their supply of naloxone via a one-time sleeve grant. Naloxone has a 2-year shelf life, and Chief Ogden's supply is about to expire. This scenario may be repeated throughout the state, particularly in instances of smaller departments. As of now, only 26 of the 46 departments of peace officers in the state are trained in carrying naloxone. Initial expense may be the reason that not all departments are on board at this time. We hope to see additional legislation that grants access of naloxone to all people who have a legal duty to respond. This will be a great need for volunteer fire departments and other first responders who do not have the budgets for naloxone. More naloxone will save more lives. First, save the life. Where there is life, there is hope. Thank you.
You know, we talk about addiction, and as part of the addiction and opioid crisis, it is also important that we focus on prevention and reaching our children and teens early. And that is what the Boys and Girls Club of Delaware are doing with their Partnership for Success program. To tell us more about the program is John Wellens, President and CEO of the Boys and Girls Club of Delaware, and our host today.
First, I'd just like to thank Highmark Delaware for this grant, in particular for recognizing that our young people are worth an investment, and recognizing that enabling experts and mentors like Boys and Girls Club professionals to engage our youth and to provide learning opportunities will result in enhanced social, emotional, and physical wellness that what we hope will lead to prevention and keeping kids away from making poor decisions that may lead them down a difficult path. Boys and Girls Club of Delaware is a leading youth development organization in the state of Delaware. We do have a statewide footprint that has 44 locations from Claymont down to Seaford and across to Rehoboth and back up the state. The importance of the Highmark funding can't be overstated. It provides support that we are able to leverage with other funding to deliver prevention programming and youth development opportunities to nearly 24,000 youth in 2017, and will continue to do so in 2018. The programming that we apply is focused on teenagers who are most at risk for substance abuse, and we administer pre and post testing of our participants, and in the past year we found that in under 20 months we were able to reduce underage drinking by at least 10%. These results that we have are really part of our bigger story. A couple of years ago, third party did an economic impact study on the Boys and Girls Clubs and what we do. And what it found was that for every dollar invested in the Boys and Girls Club programming and returns almost $14 to the state of Delaware on a broader economic impact perspective. You know, two key drivers are really part of that. One is substance abuse reduction, and the other are criminal justice savings by helping kids stay out of the criminal justice system. At the end of the day, it's about helping kids make better decisions, teaching them the skills that they need to combat and really resist the challenges that are going to come their way. And Highmark's support ensures that that Delaware citizens are going to receive these services, and we as the Boys and Girls Club are going to do our best to deliver them in a way that has an even broader impact to our community. So thank you very much for your support. We're very thankful to be a part of your program.
Our support of Gaudenzia attempts to expand treatment capacity here in Delaware. And here to speak to us today about Gaudenzia's expansion in the Claymont area is the Chief Operating Officer, Perry Patel.
Again, I wanted to thank everybody because it is only in Delaware this kind of cooperation happens. And I could share that with you because we are largest provider in Maryland, Pennsylvania, DC, and second largest in Delaware. So we just wanted to share with you that Gaudenzia is a mission-driven organization. We are growing within. We are celebrating our 50th anniversary. We serve approximately 20,000 clients each year. So multiply that by 50 years. And sometimes people say it takes a village. This crisis is going to take a village. It's going to take a lot of us to get this word out and get ready for the technology, because that's another piece that we are missing. We are at Gaudenzia implementing approximately $4 or $5 million worth of electronic health record that's going to help us to document what's happening and then to how to keep people from relapsing. We have approximately 1,500 employees, and we have a training institute within us. We take 60% of our clients to be an employee. So the treatment works. It takes time, but treatment works. Of the national statistics and Delaware statistics, 37% of the opioid crisis and the increases in year over year, we are, and especially in Delaware, but more specifically in Claymont, we took the older Everest Still building. We are building a sober living there. We would have approximately 24 women and children who would be there. On the ground floor, we would have approximately 16 men's living. We just opened up the outpatients at the Claymont Community Building. So with all the service that we are trying to bring to Claymont's increase is 833% on the opioids, while the national statistics are around 30%. So we wanted to share with you that we are going to work very hard at it, and we really thank team and Highmark for helping us through this. Initially we thought it would be under the budget neutral, it would not cost us a whole lot, but once we got into the building, the budget went up considerably. It's approximately, by the time we get set done, it's approximately a $4 million project. So thanks everybody, thanks Highmark, and really appreciate all the help from the public officials.
Thank you very much, Perry. Highmark operates statewide, and we literally have members that we serve in every county and every zip code, and we have been fortunate to work with Peggy Geisler and the Sussex County Health Coalition on other grants, and so I'd like to introduce Peggy and ask her to talk about the specific grant that we're here today. So Peggy is the Executive Director of the Sussex County Health Coalition, and that coalition is working together with 27 community partners to develop a community-based plan to address the opioid epidemic, and specifically in Seaford. So I'd like to call Peggy up and introduce her.
I would like to thank Tim, the Lieutenant Governor, and everyone here and John for hosting us today. Some words that were talked about previously was village, collaboration, and partnership amongst the private, public, and community sector. And if comprehensively we're going to solve a complex problem, we need to have a complex solution. And we have to devise that complex solution with all of the stakeholders we've heard here today. We would like to formally thank the Division of Public Health and DSAM as well, who allowed us some seed money initially to put together a complex plan that involved over 27 stakeholders in a high-intensity drug trafficking area in Seaford, Delaware. On that committee, we have, believe it or not, Public Health, DSAM, Emergency Medical Services, Attack Addiction, Boys and Girls Club, and Treatment Provider Landscapes, as well as police officers, the mayor, our county representatives, our churches, and people who have lost their children, their fathers, and also lifesavers in the ER. They're there to design programs that keep kids from ever entering down that path, to work with providers to keep people from entering down that path, or to serve them when they're trying to get help the minute they need help. But even more importantly, they're looking at the complexity of the community around when they come back from treatment, how they're embraced, supported, and loved in a way that helps them be more successful and productive to the community that they live in, work in, and serve. We at Sussex County Health Coalition and our leadership, we have 172 partners, 440 members, are honored to join in this fight. It is a long-term marathon. We appreciate the starting gun from Highmark, but we are here for the long haul. We hope all of you will join us, and I'm honored to be in the race. Thank you.
I said up front that you know, to some extent, we have, within Highmark, the easy part of giving away the money. We are very fortunate and blessed to have such great community partners on these initiatives. So we're very thankful to each of you for joining us today and all the great work that you do and your organizations do in the community. Also, I'd like to thank again Dr. Carol Rattay and everything that the Division of Public Health is doing and has done for us, and not just here on the opioid epidemic, but just in general around health issues in Delaware. And then closing, I'd like to again thank our elected officials, Lieutenant Governor Bethany Hall-Long and County Executive Matt Meyer for their engagement. They both have been great to work with on many initiatives, and we thank them for their interest and engagement and being here today. And then thank you all for joining us. You know, this obviously, we wish we weren't here, but this is certainly an issue that demands tremendous support and partnership from across the county and state, and we're thankful that you're here today with us and to help us around this. I think we can be available probably for questions after, but this will conclude the formal session. John, is that good? Okay, so thanks again.